Hi, I'm Dr. Dellaria. We're going to be using the brimhall adjuster today. This is the instrument. This is what it feels like. We use this to lightly adjust the bones back into place. Different than a manual adjustment, which brings the bone back into place in one impulse. This brings the bone back into place through a series of impulses. So we find the bones that are misaligned. There, 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 and there. We lightly adjust the bones back into place. And we recheck. And we have motion where we didn't have motion. Good. And did that hurt at all?
Not at all.
Okay, great. So that's using the brimhall adjuster.